Who would think that in one of the most progressive cities in the world, an old-fashioned and trusted medical practice is staging a comeback?
It really is 21st century medicine, somewhat in the guise of 19th century medicine.
Teams from the Washington Hospital Center perform regular house calls on elderly and chronically ill patients throughout the city.
Hi, how are you?
Hi, how are you?
Come on in.
Thank you.
Dad.
In the next 10 years, the number of Americans over the age of 80 will double, reaching an all-time high.
Patients who are getting the worst care in our current healthcare system are those who are the most sick, who have trouble getting to the doctor's office.
80% of the Medicare budget is spent on caring for the chronically ill patient. For some elderly patients, the challenges of getting to a doctor's appointment can be insurmountable. Having one come to the door is the only way for many to receive continuous primary care.
So I think Miss Ellison is the most striking example to me as I thought about those patients. So she's a lady who's quadriplegic with 6 stairs to get into her house. And the only access that her incredible daughters have to medical care is to call an ambulance if she has a fever. And what's happened over the last 2 years is when she's had fevers or some breathing difficulties from her severe MS, we can go out and visit, diagnose what the problem is at home, and add treatment in her living room so that she doesn't have to end up in the ER with a prolonged stay in the hospital.
An ER visit is more than 10 times the cost of a typical house call. The house call teams consist of a physician, a nurse practitioner, and a social worker. This interdisciplinary team integrates medical care and social services so that all is in concert in meeting the patient's needs and supporting the caregivers. This individualized, compassionate care may seem like an extravagance, but this type of care can save billions of dollars this year and billions more in the decades to come. House calls are partially funded by the hospital and private donations. The rest of the money comes from Medicare and Medicaid, but it is not enough to incentivize physicians to bring these kind of programs to their own communities. And yet, for all of the savings, this is the way medicine should be. As the people we love reach the final decades of life, isn't it amazing to think that they can be receiving individualized, compassionate care that not only supplies the latest technology, but supplies something much more valuable: dignity.
This is really how care should be done for older homebound folks. You know, that the drudgery of getting to the doctor's office is just too much for someone who's 94 and has had a stroke.
We go out and serve folks who otherwise would not get average care, and we give them the best care that I think is available in the United States.
The house call program currently operates at a loss and needs ongoing support from philanthropy and hospitals and greater reimbursement from Medicare to succeed. This is the time for healthcare reform, and we are at the forefront of that change, the kind of change people want and that our country needs.